Good morning. Today is Saturday. Let's check to be sure all of our everything is working fine. Thank you for joining. Again, today is Saturday, July the 23rd. Today is our regular Saturday morning yoga therapy class. Today's topic is prepare your breath for meditation as a part of yoga therapy. Last week we talked about preparing your body for your meditation. For us as a healthcare provider, we use the philosophy of yoga and the 8-limb practice of yoga as an adaptation for yoga therapy based on our patients' or clients' clinical condition. Meditation is the medication. If you look at the spelling, there is only difference of one letter. Meditation has a T, medication has a C. T stands for your transformation, and C in the medicine stands for your choice. You have a choice of taking medication, or you have a choice of practicing meditation. At which state, remember this, at which state our body is capable of producing every medication you take from outside to correct or control your chronic lifestyle related disorders. The body can adapt, body can create a baroreceptor sensitivity which will act like a beta blockers. Mind and body can create a profound relaxation response with peripheral vasodilatation, reduction of your peripheral resistance, reduction in the afterload of your heart, and with a proper voluntary regulated breathing like pranayama, you increase the preload of your heart. As we discussed last time, the body needs to be prepared with a relaxation response and to create or elicit the relaxation response. You need to practice to keep your spine straight throughout the whole day and practice the asanas which keeps your spine straight. Sthiram, stillness, sukham, happy, asana pose. Sthiram, sukham, asanam is the asana, prepare the body for meditation. For the breath, which is the fourth limb called pranayama. Pranayama is not a breathing exercise. Pranayam. Prana is the subtle energy. Prana keeps us awake, alert and alive. Yam means control and restraint. You learn how to control and restrain your life force. Breath is not prana. Breath is the carrier of your prana. Metaphorically, prana is like an electricity and breath is like your electric cable. Our breathing is both conscious and subconscious. I'm sleeping, I'm breathing. That's a function of my autonomic nervous system. I'm here sitting in front of you. I can breathe out first, then take a deep breath in. Then do a long breathing out. This is our voluntary breathing. This is the function of your cortex of your brain. And involuntary breathing was function of your brain stem, the site of your autonomic nervous system. So breath is the connector between your conscious and subconscious brain. So in yogic tradition, the conscious brain is controlling my physical body, and subconscious brain is controlling my mind. So breath is the connector between our body and mind. Metaphorically, if you're flying a kite, if the kite is the mind, is the roller you are holding is your body, the thread connecting the roller to the kite is your breath. By practicing the voluntary regulated breathing, you also develop neuroplasticity. That means when you develop the pattern of your breathing, it becomes your habit or neuroplastic. That means that is the way you breathe throughout the whole day and night. So breath is the voluntary control over involuntary function. What does it mean? Involuntary function means your autonomic nervous system. And voluntary control means yogis and yoginis with their practices are able to control their autonomic nervous system, which we as ordinary people can do it. Our nervous system is voluntary nervous system. I can move my hand, the function of my cortex is a voluntary nervous system. Involuntary nervous system, we don't have much control, like I can look at a food and my stomach will start secreting acid. It's an involuntary nervous system, and you may also have some control over that. Autonomic nervous system is the nervous system, sympathetic and parasympathetic nervous system, which is controlling our heart rate, respiratory rate, breathing, which normally we have no control. But the yogis and yoginis with the practice, they have a control over autonomic nervous system. Another function of our body, which is both voluntary and involuntary, is your blinking. And you can do a lot of blinking practices to have a control over your autonomic nervous system. The muscles of the breathing are also called skeletal muscles, voluntary muscles. That means these muscles are also trainable. Like if I have a biceps, if I can do a biceps curl, if I take a weight, I can do it at 5 pounds. In a 3 to 4 weeks, I'll be able to go to 7.5 pounds. In a month and a half or two, I will be able to do 10 pounds. I can do 15 pounds, 20 pounds, 25 pounds. I'm taking all this because I do, and when you do the breathing, like muscle before contraction needs an oxygen. So before the muscle contracts, I breathe in. I breathe out first, take a deep breath in. During breathing out, I'm doing my biceps curl. Breathe in, breathe out. Breathe in, breathe out. If you remember this, the muscle needs oxygen before its action. You will have no problem connecting your breath during your asana practice. So, if I can breathe today X number of breath per minute, I will be able to extend it slowly and slowly, and I will be able to reduce the number of breath per minute. For the meditation, it's the mind needs to quiet down. Manasthi. In meditation, you enter in between your thought process. You have thousands and thousands of thought process. You enter into the thought process, which is called gap, because most of your thoughts are a repeat thought process. It's like a monkey brain, or you call it, it's like a Niagara Falls. When you enter into the gap and slowly expand your gap, it sustains throughout the whole day. Then this Niagara Falls became a river became a pond, and you can look directly through the water and your mind quiets down. How does the role of breath to quiet down your mind, or preparing your breath for meditation? First, our normal breathing rate is between 15 to 16 per minute. So if it is around 15 to 16, our normal breathing cycle probably around 4 seconds, maybe 2 seconds in, 2 seconds out. If you can slowly extend your inhalation and also extend your exhalation longer than inhalation without any effort in your breath, which is called effortless breathing. Effortless breathing means I'll be able to talk, I'll be able to sing. And if you keep on practicing, because it's a voluntary function of our body, slowly and slowly you'll be seeing a neuroplasticity will set in, and you will be able to breathe, say, 2 seconds in, 4 seconds out very easily. So 6 seconds a cycle. Now your breathing rate is already dropped down to 10 per minute. Then you slowly extend it. 3 seconds in, 6 seconds out. You practice for another 4 to 6 weeks. Neuroplasticity generally sets in within the 30 to 40 inputs. That means when you keep on doing it for 30 to 40 times, this neuroplasticity, this means habit, forms. So 3 seconds in, 6 seconds out, 9 seconds. So your respiratory rate almost down to 7, maybe a little less than 7, so around 7. You can slowly and slowly do it to the point that we've been doing it for a long time. We can do 8 seconds in, 16 seconds out, so very easily without any effort. And when you can keep doing it like this, then what happens? You develop this neuroplasticity that you will be breathing like that even during sleep. The breath quiets down to the point it is so effortless that when you breathe in and out, nobody will be even hear, nobody even know you are breathing. I had a fascinating experience. I sat down next to this yogi and he or she is breathing. I don't hear anything. I don't know even they're breathing. So, extending exhalation. Exhalation is parasympathetic, inhalation is sympathetic. Extending exhalation extends your longevity. Extending exhalation is the most powerful effect of your voluntary regulated breathing. Now, when you extend your inhalation and exhalation, your respiratory rate, the number of breath you take per minute, slowly comes down. And a simple way of putting it, slower the breathing rate, longer is your longevity. We make fun of it. We said that God gave X number of breath for us, and if we use it too early, we leave this universe early. If we do slow breathing, we live longer. In the nature, somebody is a fast breather, live lot less than the animals with a slow breathing. Turtle with a slow breathing lives extremely long life. Dog with a very rapid breathing doesn't live that long. So the first and foremost practice is able to sit down in a comfortable posture, whether you are sitting in a chair or sitting in the ground is up to you. What is your state of your asana practice? Keep your spine straight. And I have this chair here. I'm sitting on this kneeling stool, as all of you have seen. When I sit on a kneeling stool, I keep my back straight. Let me go to the floor and the ground so I will be able to continue the breathing practices for preparing your breath for your meditation. Okay. The first preparation we do during our morning ritual, call it dinacharya, daily practice, we do a jalneti, In the morning, we brush our teeth. And the first thing in the morning, we sit down in a squatting position called Malasana, drink a glass of water in the room temperature with a drinking in a gulp. So you had a bowel movement first thing in the morning. You do a tongue scraping, then you do a neti pat and wash your nose with a gel neti. And you have seen me, or if not, you can go to my YouTube. I have plenty of gel neti in that YouTube, how to do it. It just takes just a minute. Once you do the gel neti, you put your water in your nostril, water comes out on the other side, and you do a lukewarm water like a body temperature with a little non-iodized salt in it. Blow your both the nostril, doing the other side, and then after the gel neti, you do Kapalbhati Pranayama in different posture, which I have shown you. Standing up, head down, head to the right side, head to the left side, and then hitting your frontal sinuses. Because some of the water stays in your sinuses. And that's why I have a piece of, facial tissue, because we do get some drainage. And you will see when I'm doing a little bit of a pranayama practice, I'll have some drainage. So we prepare ourselves with the gel neti every morning, and we're able to sit down with a spine straight, eyes closed, and with a meditation mudra, touching index finger and thumb. Visualize our breath. Breathe out first. Take a deep breath without any effort. Breathe out longer than breathing in. If you're practicing with me, you start in stages. Remember, always breathe out first, because lung is like a balloon. You need to empty the balloon to get the fresh air in. You can start with a 2-second in, 4-second out, which will be very easy for you. You can progress slowly. Let me show it to you now. I will do a 4-second in and 8-second out. Then I will do 6-second in, 12-second out, 8-second in, 16-second out. Just to show it to you how easy it is for us to do it, because I've been doing it for a long time. 4-second in, 8-second out. Breathe out first. Very easy for us because we've been practicing for a long time. 6-second in, 12-second out. Breathe out first. Very nice and easy without any effort. Let me show you also 8 seconds in, 16 seconds out. Breathe out first. Wonderful experience. Our cough comes from our larynx. When you breathe in and the air goes into the larynx and larynx gets a little irritated. And as I told you, I'm still not completely cured for what is going on with me for last 2 months after taking my second booster. My larynx is still sensitive and I can see every time I breathe, I got a little bit of a cough. So, I change my foot again. This is to activate both sides of the brain, which is a very normal asana practice. After able to do extension longer than inhalation, we prepare our breath with a very gentle breath holding. I hear it all the time. Do not practice pranayama without a guidance. Do not do a breath holding. It is dangerous for you. Whole yoga practice is a self-guided practice. You do not compete with anybody, you listen to your body's signal. If you're doing asana without going to the stage of pain, if you're doing it asana with the effortless breathing, if you're doing the breathing practices as if it is your normal breath, and slowly increase the timing, reduce the rate, and essentially what you get, what we call a deep breathing. You don't try to do a deep breathing initially. This is called a Savitri Pranayama. Savitri Pranayama is very excellent for quieting down your breath for meditation. Savitri Pranayama is a breathe out first. You take a deep breath in. You hold your breath after inhalation. Then you breathe out. Then you hold your breath again after exhalation. Inhalation in yoga called the Purokama. Breath holding is called Kumbhak. Breath holding after inhalation, which we call retention, is called Abhantarin Kumbhak. Exhalation is called Rechak. Breath holding after exhalation, which we call suspension, is called a Vajra Kumbhak. Normally in a Savitri Pranayama, it's in a ratio like we do 1:4:4:2. That means we'll do 4 seconds in, 8 seconds hold, 8 seconds out, and 4 seconds hold. Breathe out first. Breathe in and hold. breath hold. If you practice it in a short time, your breath will quiet down and you'll feel a profound level of relaxation. Then you incorporate breath holding in inhalation with your locks. Chin lock called Jalandhar Band, which stimulates your carotid sinuses. When it stimulates your carotid sinuses, it quiets down and activates your parasympathetic activation. It's called a Mursha Pranayama. Mursha is like unconscious. I'm going to show you the techniques, and if you're watching it, you can practice at home and do it few times. People always ask me how many times, how long. I said, you listen to your body's signal. As long as you can do it without any effort, as long as you are talking, singing, it's okay. Breath holding and exhalation with the abdominal lock, Ujjayi Band. Breath holding and exhalation with the root lock, Mula Band, abdominal lock, Ujjayi Band, and a chin lock, Jalandhar Band, called a Mahaband. It is a wonderful, wonderful experience in your body and mind, which completely take you to the state of meditation. So the first practice is Mursha Pranayama. Physiology behind it: when you hold your breath, your lungs starts to expand. When lungs starts to expand, because the air is inside the balloon is expanding, it comes to the level of your rib cage. When it comes to the rib cage, it cannot extend anymore. Then a reflex sets in, called a Herring-Brewer reflex. It is activation of your vagus nerve, and then the balloon slowly starts to deflate, so you don't extend anymore. So breath holding and inhalation is a better exchange of gases and also activation of parasympathetic tone. Chin lock is the activation of your carotid sinuses. Already have some saliva in my mouth, suggesting I have a parasympathetic activation. Breathe out first. Take a deep breath in. Hold your breath. Slowly incorporate chin lock. Bring your chin down close to your chest without bending your neck. And stay in this posture as long as you can without any effort. Wonderful experience. Mursha Pranayama. Do it a few times, do it before going to sleep. Meditation is the effect of sleep in your body and mind without falling asleep. Breath holding and exhalation with abdominal lock. Breathe out first. Take a deep breath in. Completely breathe out and suck your stomach in. This is called a Bajja Pranayama, breath holding and exhalation. You can do a Mahabandh. You can do breath holding and exhalation with the root lock, contracting pelvic floor and pulling it up, abdominal lock and chin lock. And all the yogis and yoginis, they don't leave home without this practice. This is a wonderful, a therapeutic yoga practice because this leads you to your meditative experience. I'm showing how to do it one at a time. I'm not doing the complete practice because of the time constraint. Or if you come to my class, probably, hopefully we'll start after the pandemic is over and we'll do a practice in that class. Breathe out first. Deep breath in. Completely breathe out. Suck your stomach in and hold. Contract your pelvis and pull it up. Put your chin lock down and stay in this posture. Wonderful practice. Bhastrika Pranayama. Bhastrika is a bellows. Bellows is you use it for blowing your fireplace, or maybe blacksmith uses it. It's active inhalation, active exhalation. It causes a hyperventilation and also causes an altered sense of consciousness. It is the constriction of the cerebral blood vessels. It reduces intracranial pressure. It causes circummoral numbness, causes carpopelvic spasm, and whole gamut of symptoms like a hyperventilation. But if you do very rapid Bhastrika Pranayama followed by Savasana, you will immediately enter into a state of meditation. We practice this with a lot of patients with neuropsychiatric disorders. So generally what we do an active inhalation and exhalation. Like here, breathe out first, breathe in, and breathe out. We always balance our practice. So still having some drainage through my nostril, and blowing this nose after Jalneti is a very common practice. Welcome. We'll do the opposite. Now what I'll do, I do breathe in here and breathe out here. It can be a rapid Bhastrika Pranayama with the hand raising high up followed by Savasana. Or you can do without hand raising up Bhastrika followed by Savasana. Let me show it to you. Raise the hands high up, do it very rapid Bhastrika followed by Savasana. You will be in a state of meditation right away because of the effect of this hyperventilation and Savasana both. Unbelievable effect in your body and mind. You also can do with the Adhi Mudra, put thumb inside and close. Keep your hands gently resting on your knees and do a very rapid Bhastrika Pranayama. People always ask me, we are taught to pranayama very slowly. Why are you doing so rapid? I'm not doing any rapid. What I'm doing it, or we are doing it, listening to our body's signal and doing it effortlessly. We have done it for so long, we can do it this effortlessly, as fast as possible, without any harmful effect on our body and mind. So this is the second practice followed by Savasana will be I can continue a lot longer, but just showed you how to do it. Generally we do about 400 to 500 of this for a period of 3 to 4 minutes and followed by Savasana. Kapalbhati Pranayama, there's a balloon here, there's a diaphragm here, a balloon here. You hit the belly button to the back. It hits the diaphragm, it massages all the abdominal contents, it hits the diaphragm, it massages your heart and lung, and the air comes out. For a pranayama practice, we do it this with every mudras, 10 to 12 mudras for therapeutic purposes. And when you do a full pranayama practice, I'll show it to you. For a meditative practice, you do the Dhyana Mudra or Jnana Mudra. Keep your spine straight, keep your eyes closed, bring your awareness to your belly button, and you push the belly button to the back, and the air will come out through your nose. Active exhalation with passive inhalation. We make no effort of breathing in. Breathing in is effortless. One per second. It ignites your Jathar Agni, the digestive fire. It is called Agni Pradhan Pranayama. Bhastrika Pranayama is called the Prana Pradhan Pranayama. It brings the prana. Kapalbhati. Kapal is a forehead, Bhati is a shining. When your Agni, the fire within you, ignites, it creates a tejas. Tejas is the aura around you. That aura is shown up, what is called Kapalbhati Pranayama. What is most interesting thing is, if you keep your spine straight and eyes closed, have your meditation mudra and keep doing this Kapalbhati Pranayama, within a short time you will enter into a transcendental state without any connection to the outside world. In fact, you will go through the next steps of the Ashtanga Yoga, the 8 limbs. You will enter into a 5th one called Pratyahara. Pratyahara is a reject, ahara is the input. You learn how to control your 5 senses. I hear, I see, I smell, I taste and touch. Enters into the 6th limb called focus, dharana, and slowly enters into 7th limb, which is a meditation. Meditative breath of fire, Kapalbhati Pranayama. Next we do alternate nostril breathing, Anulom Vilom Pranayama. Then finally we do a meditative alternate nostril breathing, which is your alternate nostril breathing without closing your nostril. Let's do it at the end because we'll be entering into a state of meditation. Generally, after a practice of Kapalbhati Pranayama, which we do it for a long period of time, because we can do without effortlessly. Initially you do as long as your effort will let you. If it is 20 counts, 30 counts, good. We do it 500 times, 1,000 times, 5 to 15 minutes sometimes. Very effective pranayama for your truncal obesity, diabetes, and your, we call it a kapha related disorders. Bumblebee Pranayama, Bumblebee Breathing, is the real preparation of your breath for your meditation. Any chanting, any mantra, man means mind, tra means a vehicle, any vibration which has the same frequency as the frequency of your body and mind interacts and causes harmonic resonance, quiets down your body and mind. Your mind is the content of your 5 senses. Shut down your 5 senses, you create a vibration like the sound of a bumblebee, and your whole mind quiets down, prepare for your meditation. Index finger in the forehead, 3 fingers to close your eyes, thumb to close your ear, and close your mouth. You are literally shutting down your vision, your hearing, smell and a taste by mouth. We'll breathe out first, take a deep breath in and breathe out with the sound of a bumblebee. Rub your hands. Rub your hands. When you feel the warmth in your hand, if you're wearing glasses, you remove the glasses, take both the hands like a cup. Put it over your eyes, let the eyes all the heat from your hand. It relaxes your ciliary muscles in the eye. Ciliary muscles in contraction pulls your soft lens, loses the convexity, and became presbyopic. You cannot read the small prints. You need a reading glass. When ciliary muscles are relaxed, the lens becomes more convex. It almost acts like your reading glasses. Massage your forehead, massage your eyes, massage your face. All the muscles in the face and head and neck area are attached to your skin. Muscles are relaxed. All the lines goes away. All the frowning lines, all the lines in your face goes away. Take your hand behind, massage your earlobe, massage your ear, massage outside, inside, even inside the external ear canal. There's a nerve called the auricular branch of vagus nerve. It stimulates your vagus nerve. Massage in front of your neck on both sides. It's massaging your carotid sinuses to have a vagal response. We all talk about polyvagal theory, but it's all vagal response is the outcome of your yoga therapy. Massage in the back. There is a occipital tubercle. There is the insertion of the sternomastoid and trapezius muscle. Both are supplied by your cranial nerves. Wonderful practice to prepare your breath for your meditation. Ujjayi Pranayama. Ujjayi is a victorious. You learn how to slowly and slowly constrict your larynx, but with a completely relaxation state. You are not constricting your larynx. Larynx is supplied by the two nerves, superior and inferior laryngeal nerve, which are supplied by the vagus nerve. So when you slowly constrict your larynx, the signal goes through vagus nerve, because vagus nerve is almost 80% afferent. That means input. It goes to your brain stem. Efferent or exit comes through your hypoglossal nerve, which goes to your soft palate, palatopharyngeus and palatoglossus muscle, tightens them up. It literally corrects your snoring. Efferent also comes through hypoglossal nerve to your tongue, pushes the tongue in the front, and it becomes a therapy for your sleep apnea. Ujjayi Pranayama very effective for snoring and sleep apnea. In fact, snoring is a sign of your sleep apnea. Ujjayi Pranayama also incorporates your chin lock. Ujjayi Pranayama is very relaxing as a vagal stimulus. Then it incorporates with your massage of your carotid sinuses. Then it finishes with your left nostril breathing, which is called the Chandra Nadi, moon energy, or parasympathetic energy. Let's practice this one time to show it to you. Breathe out first. Take a deep breath in. Completely breathe out. Ujjayi Pranayama, victorious breathing, to chin lock, Jalandhar Bandha, left nostril breathing. Literally quiets down your body and mind to enter into a state of meditation. When you first practice Ujjayi Pranayama, you practice in a burst a little bit. If you get a cough, it's entirely normal, because cough tells you that you are really constructing your larynx where the cough comes from. You can do chanting. Powerful chanting is the sound of Om, A-U-M, A-U-Ma, same frequency. You can also do with a pranayama called your Pranav Pranayama. In a Pranav Pranayama, you do 3 mudras. When you touch your index finger and thumb, this is called your, when your arm is up, it's called your Jnana Mudra or Dhyana Mudra, meditation mudra. Put your hands down, it's called a chin mudra. It opens the lower part of the lung. If you close your other fingers, this is called Chinmayi Mudra. It opens the middle part of your lung. If you put your thumb inside and close your hand, this is called Adhi Mudra, called Bala Mushti Mudra, or like a baby fist, it opens the upper part of the lung. So we do the A, U, Ma with the 3 mudras, and this is called a Pranav Pranayama, and slowly you are taking you to the entirely to the state of meditation. Chin Mudra. Chinmayi Mudra. Adhi Mudra. We'll finish with a meditative alternate nostril breathing. Normal alternate nostril breathing is part of our daily practice. Doing a pranayama practice, once you prepare our breath, we first do a Bhastrika, then we Kapalbhati Pranayama, this is called breath of fire, then it's called alternate nostril breathing, Anulom Vilom Pranayama, which is also called a Vayu Pradhan Pranayama. It controls your Vata, then you do your Bumblebee Pranayama, Bumblebee, then you do Ujjayi Pranayama, your constriction of your larynx. We also do what is called a Shankha Pranayama to improve your, we call it a resistive exhalation. Ujjayi is a resistive inhalation, Shankha is a resistive exhalation. Then we do a Savitri Pranayama, we do a Prana Pranayama, also the Sitali Pranayama, Sitkari Pranayama, Sadanta Pranayama, Plavuni Pranayama. Since the talk, let's just show you one, what is your Shankha Pranayama, blowing a conch shell. Use your hand to a Adhi Mudra, thumb inside, put one in the top. It is resistive exhalation. Breathe out first. Take a deep breath in through your nostril. Breathe out through your mouth to the resistance. Normally, we do the alternate nostril breathing, like closing your hand. And remember, we always do our practice with a health tracker. With a health tracker, so we have all the health parameters during our practice, so you know exactly the physiological effect of this practice. Left hand in a meditation mudra, dhyana mudra or a jnana mudra. Right hand to close your right nostril. You don't have to close it all the way, just close underneath your nose. Breathe out through left nostril first. Then breathe in through your left nostril. Close your left nostril with the ring finger and little finger, and breathe out through your right nostril. Breathe in through your right nostril. Close your right nostril. Breathe out through your left nostril. Then continue alternate nostril breathing. Breathing out longer than breathing in. Left nostril is controlled by the right brain. Right brain is intuitive, right brain is female, right brain is parasympathetic. Left nostril breathing is your cooling Chandranadi. Parasympathetic. Right nostril breathing is controlled by left brain, which is analytical, which is male, which is heating, which is sympathetic. Right nostril breathing is called Suranadi, sun energy. It balances both sides of your brain. Wonderful pranayama for your hypertension, water-related disorders, improving your memory, dementia, Alzheimer's disease. Then you can put your index finger and middle finger in the third eye, like a Vishnu Mudra. Continue your alternate nostril breathing. To bring more balance back, you can have your left hand holding your right earlobe. It's like a super brain yoga. Continue alternate nostril breathing. You also can incorporate a breath holding. It's called a Nadi Shuddhi Pranayama. Generally, we do in the ratio of 1:4:2. 1 in, 4 hold, 2 out. 4 second in, 16 second hold, 8 second out. It literally, when you incorporate this breath holding, that is such a powerful vagal response, you enter into profound parasympathetic tone. Use a mudra called a Vishnu mudra. Put index finger, middle finger down, have a pinch with a little finger, ring finger and thumb. Pinch over your nostril. Breathe out through your left nostril. Breathe in for a count of 4 in. Hold the breath for 16. Breathe out the opposite nostril, count of 8. When you're comfortable, you can increase the number by the same ratio. We'll show you one time now to 5. Breathe in through the right nostril with a count of 5. Hold for count of 20. Breathe out through opposite nostril, count of 10. You have even no idea where you are. You will be totally in a transcendental state. The last practice, which initially looks like almost impossible for all of us to do, but with the practice you will be able to do. Alternate nostril breathing without closing your nostril. Is exactly exploring your subtle body. You have 3 bodies: gross body, sthula sharir, subtle body, sukshma sharir, connected to your mind, and your causal body, karana sharir, connected with your spirit. When your body and mind is connected, you are able to see your subtle body. My subtle body is a body of my memory. Here I am sitting in my place in Bethesda, Maryland. I presented a few weeks back in San Antonio, Texas. I can clearly see myself. I'm in San Antonio, Texas. I'm in the conference room, 214 B and C. I'm sitting on the stage and I am practicing. Clearly I could see. Also here I can, with my eyes closed, I can touch tip of my nose, top of my head, touch my left shoulder. I can touch my left great toe, right great toe. So, when people say it is almost impossible, I say, why don't you try? quiet down your mind, access your subtle body. Breathe out through your left nostril without closing your right nostril. Breathe in through your left nostril. Breathe out through your right nostril. Breathe in through the right nostril. Breathe out through your left nostril. Now practice this with your eyes closed and in silence for a while. You will see you are totally in a meditative state. We hear it all the time. I'm doing my meditation and all the thought processes are coming. What I'm going next, what I have to do next, what I've done before, what will be my future. Our answer is very simple. You are like the sky, and your thoughts are like the cloud. When the cloud comes or the thought comes, don't resist them. Let them come. They will come and slowly they will go away. Slowly and slowly the cloud is going to go away and you will be the bright blue sky. Slowly put your hands in front of your heart chakra. Touch your little finger and thumb. Separate your ring finger, middle finger and index finger. Padma Mudra, Lotus Mudra. It connects your body, mind and spirit. Bring the Lotus Mudra close to your heart, the side of your soul. Heart is connected through your mind. Heart has all the emotions, rasas, 9 emotions. You are in a state of meditation. Body is being prepared, breath is being prepared. You are in a state of meditation, and meditation is the medication. Difference between meditation and medication is your to my, where is it? Okay, I'm sorry, I got interrupted by whatever, it happens. So, when you are having this Padma Mudra, you are in a state of meditation. Meditation is the medication. Meditation has a T for transformation. From rogi, people with disease, to nirogi. People who are healthy, no disease, to yogi and yogini, who enjoys a good quality life with a balanced body, mind and spirit. Hands together in front of your heart chakra, Anahata chakra. Bow your head down. I honor the divinity within you, and when we became healthy, everybody around us becomes healthy. In yogic tradition, we cannot change anybody, but we can change ourselves. And when we change ourselves, people around us also change. Thank you again. It was a wonderful practice for preparing your breath, body and breath for meditation. And we'll probably continue the series and a practice meditation next time. Please send me any comments or question, and when I get a time, I'll sit down, I'll be able to answer for all of you. See you soon. Bye-bye.